Good morning. Welcome to another exciting meeting of Sattvic Toastmasters Club for Healthy Living. I'm Toastmaster Amarnath, your sergeant at arms for today's meeting. At Sattvic Toastmasters, we strive to inspire personal and professional growth all the while embracing a holistic approach to living. So let us take a moment to remind our mission guides us. The mission of Toastmasters Club is to provide a supportive and positive learning experience in which members are empowered to develop a communication and leadership skills, result in greater self-confidence and personal growth. To ensure our meeting runs seamlessly and enjoyable for everyone, please keep the following ground rules in mind. So speakers are requested to employ caution when making any reference to sensitive topics such as politics, sex, and religion during the meeting. Please turn on your camera and ensure your mic is muted when you're not speaking. And please don't interrupt any speaker in between. Kindly rename yourself with the role prefix to your names. If you are a guest, may I request you to kindly prefix guest in front of your names. Our club, Sattvic Toastmasters, is for healthy living, focus on wellness and healthy living. And we take any information which is shared here with thoughtful consideration. Please remember that any of the information shared in this meeting is just for a general knowledge purpose and educational purpose only. This is not a professional medication advice. If you are consider any actions based on what we have shared here, we encourage you to consult a qualified medical professional. Your health decisions are your responsibility. So with this, I officially open this meeting, hand it over to our presiding officer for today. It's Toastmaster Ishita. So Ishita has worked in corporate world across India and USA. She has been a Toastmaster for more than years, and she is living in Bhubaneswar, Odisha. She is passionate about mental health, self-development, and wellness, and she loves to speak about these topics. So without any further delay, I'll hand it over the virtual podium to our presiding officer today, Toastmaster Ishita.
Hello, good morning, and welcome to yet another episode of Sattvic Toastmasters. I welcome each and everyone with a huge round of applause for showing up on a Sunday morning and participating in your growth and in learning about health. At Sattvic Toastmasters, we are not only about public speaking and leadership skills, but we are also about learning all about healthy living. And once in a while, we also conduct keynote sessions to invite doctors from the health profession to enlighten about the upcoming technologies and tips that we can use in our day-to-day life. Sattvic Toastmasters in an online club where we focus on leading a Sattvic healthy lifestyle, self-healing, research and debate on alternate medicine, interculture experience where members from different parts of the world get a platform to safely discuss their views and opinions, interpersonal communication, storytelling, and critical thinking. So without further delay, I welcome all the guests. We have our keynote speaker, Dr. Mansij Biswas, with us. I will introduce you in a little bit, sir. And then we have Ilios Theophilus with us. Could you take a few seconds to introduce yourself and let us know?
Hello.
You're joining us after a long time. Yeah.
Yeah. Hello. Can you see me?
Yes. Hi, Ilios. Yeah. So nice to see you after such a long time.
Yeah. Hello, everyone. I'm from Indonesia, District 87, but now I'm in District 80, Singapore. I have been Toastmaster for 5 years. During this journey, I've been keynote speaker, workshop speaker, panelist about podcasting, comedy, humor, and soft skills. I got inducted into National Book of Record of Malaysia for 102 hours of training and got featured in Toastmasters magazine July 2024. Back to you, Ishita.
Thank you so much, Ilios. I had pinged you. Can you be the counter today? Are you comfortable?
Oh, sorry, I cannot. I'm multitasking right now.
Okay, sure. No worries.
Yeah.
No worries. Yeah. Next, I would like to invite Sailani Sharma. Hi, Shailani. Could you unmute and introduce yourself?
Hi, Ishita. This is my first day in Toastmasters, so I have been, yeah, I was in touch with Mr. J.K. Arora sir. So he was my college alumni also. So I'm from IFT and I graduated last year. And currently I'm working in United Breweries, Kingfisher. And this is my first day, so I want to have a just like how this meeting happened and how, um, everyone's participate and how things go ahead. So this is my first day to see whether this will work or not. So yeah,
Okay, welcome, Sailani. This is your first time, so
yeah. Thank you
that
so much.
this and this is a special session where we have a keynote speech along with the regular Toastmaster meeting. So you'll get a
Okay.
flavor of both and enjoy the whole session. So I
Sure,
hope you
sure.
like
Thank you
it
so much.
for wanting and want to come again and again. So that's what.
Yeah, sure.
Yeah. Next is Mohini Ramalingam. Hi, Mohini. Can you please unmute and tell us a little bit about yourself?
Hello, I'm from Coimbatore Speakers Forum. I'm a Toastmaster. I just saw the link today and I thought I'll join this meeting and see what Sattvic Toastmasters is all about.
Yes, thank you so much. You have joined on the right day because Sattvic is all about healthy living as well as about public speaking. So we have both the Toastmaster meeting as well as the keynote speech today. So thank you for
Okay,
joining.
thank you.
Yeah.
Thank you.
And with that, I'm the Toastmaster of the day for the evening as well. And I'll start the session officially. I'll wear my T-Mod hat and welcome once again. A regular Toastmaster meeting consists of 3 sections. One is the prepared speeches, table topics, and evaluations. The prepared speeches will happen right after the keynote speech is completed, where the speaker speak for 5 to 7 minutes. We only have one speech today because of the keynote speech. Then we have the table topic speaking, where it's all about impromptu speaking. A topic will be given to our guests and members, and they can speak and practice impromptu speaking. And finally, there will be evaluations, because evaluation is the breakfast of champions, and we all need to grow with our evaluations. So that's why we need to pay special attention and take it constructively and positively. Now, I'd like to invite our general evaluator, Toastmaster Amarnath, to introduce his team and tell a little more about the evaluation. Over to you, Toastmaster Amarnath.
Thank you very much, our Presiding Officer Ishita. So I'll be the general evaluator for today. So what I'm going to do today. So I'm evaluating the overall meeting from starting of the meeting to ending of the meeting. So my job is to be eye and ears of the meeting, make sure that we all on track, that everything runs smoothly in the meeting. So I'll call my tag team. They help me to evaluate the overall meeting. So I'll call Toastmaster Sharon. He's the timer. He will introduce his role. Yeah, Sharon, unmute yourself. Yeah.
Good morning, Toastmaster of the day, fellow Toastmasters, and dear guest. I am Toastmaster Charanteja from Pragati Toastmaster Club, and I will be timer role for today's meet. As a timer today, my role is to help each speaker manage the time well and stay within their time periods. For the benefits of our guest, there are 4 segments: keynote speech, prepared speech, table topic session, and speech evaluation. In keynote speech, the time period will be 20 to 25 minutes. I will show green card for 20 minutes. I will show yellow card for 22 minutes, and I will show red card for 25 minutes. For prepared speeches, the time period will be 5 to 7 minutes. I will show green card for 5 minutes, and I will show yellow card at 60 minutes, and I will show a red card for 7 minutes. There will be a grace period for 30 seconds. For a table topic session, the time period will be 1 to 2 minutes. I will show green card at 1 minute, yellow card at 1 minute 30 seconds, and red card at 2 minutes. There will be a grace period for 30 seconds. At last, speech evaluation. The time period will be 2 to 3 minutes. I'll show green card at 2 minutes, yellow card at 2 minutes 30 seconds, and red card at 3 minutes. I will present my timing report when general evaluator called during the meeting. I was little bit confused by showing the green cards. I'll show in the timer cards. Um, so I will present my timer report after a general evaluator call during the meeting. Over to you, general evaluator.
Thank you very much, Sharon. Meantime, you can add your virtual background with the timer cards before we start the meeting. So let me call upon our grammarian of the meeting today. It's Toastmaster Aniket. Aniket Gupta, you can explain your grammarian role.
Yeah, I am the grammarian for today. My role will be to keep a note of all the good and not good usages of the grammar, and also the usages of the word of the day and the idiom of the day. And I will present the word of the day is invigorate. It is its meaning is to give strength or energy to someone or something. An example will be a morning run can invigorate both the body and the mind. And the idiom of the day will be an applied means eating healthy can help maintain good health and reduce the need for medical visits. Example would be
Sorry,
while
Aniket.
discussing nutrition.
Sorry to interject, but I couldn't be able to hear you better. Is everyone able to hear him? Can anyone confirm?
No, his voice is breaking. Yeah.
Yeah, it was
Aniket,
not
can
audible.
you fix
Can you
your
make
net?
your network better? Yeah.
Can you check once, Aniket?
I can do the R counter role, Amarnath, if Aniket, is your network
Sure.
fixed?
Yeah, is it audible now or?
Yes.
Is it better now? Good.
Yeah.
Okay. I am the grammarian for today. My role will be to keep a note of all the good and not good uses of the grammar. So I will present my report at the end of the meeting, and also I will present the word of the day and the idiom of the day. The word of the day is invigorate. Its meaning is to give strength or energy to someone or something. An example will be a morning run can invigorate both the body and the mind. And the idiom of the day will be an apple keeps the doctor away, meaning is like eating healthy and understanding good health and reduce the medical visits. So an example will be he lives by the motto an apple a day keeps the doctor away and rarely gets sick. So I will advise everyone to use the word of the day and idiom of the day. I will also keep in the chat.
Thank you, Aniket. Thank you for explaining. I just put the word of the day and idiom of the day in the chat so that it's useful for everyone. Yeah, and our next role player, our counter, Toastmaster Ishita. Ishita, can you explain your role?
Yes, thank you very much, Toastmaster Amarnath. I'm playing the R counter role today, and I will be keeping a count of how many filler words everyone is using when they speak and come on stage. It's very important to not use filler words. For example, you know, right, like. We use some of these words and sounds which are unnecessary for communication just because we are nervous and we are fumbling for the word to come. So during that time, I request everyone to stay calm, take a little pause, and then continue so that you don't distract your audience with these filler sounds. At the end of the meeting, I'll come on stage and provide a report of every person's number of filler words. Over to you, Toastmaster Amarnath.
Thank you very much, Ishita. So we'll come up with the evaluation report after the meeting. So hand it over to you, Toastmaster of the day, Ishita Patnaik.
Thank you so much, Toastmaster Amarnath. Back to wearing the Toastmaster of the day hat. We are going to now proceed with our meeting, and the theme of our today's meeting is diabetes prevention and management. To explain more about this topic, we have with us Dr. Mansij Biswas, who's an expert in this field. He is a physician, researcher, and seasoned medical affairs professional with a demonstrated experience of working in the healthcare field and pharmaceutical industry. Graduated from Calcutta Medical College, Kolkata, India, and postgrad from King Edward Memorial Hospital, Mumbai, India. With a management degree from Liverpool Business School, Dr. Mansij Biswas is currently the global medical lead at Dr. Reddy's Laboratories, Hyderabad, India. Please give a huge round of applause and welcome Dr. Mansij Biswas on the stage. The stage is all yours. Over to you, Dr. Biswas.
Thank you, Ishita, and thank you everyone for joining, especially in a Sunday morning. Can I share my screen that way, because I have some presentation that's allowed, right?
Yes. Please
Yeah, okay.
request and you'll be granted.
Okay. It should come by now.
Yes, we can
Yep.
see your screen.
Okay, great. So I understand the time constraint. So please knock me once, because I am possibly unable to see the screen of the timer. So just knock me once when the 20 minutes are over. But I believe I will be within that timeline. So yes, currently I'm working as the global medical lead for Dr. Reddy's Laboratories India, based in Hyderabad. I look after the diabetes, cardiology, and multiple other portfolios in Dr. Reddy's across the world. Just couple of disclaimer maybe before we begin. Firstly, this is whatever I'm going to speak next for the next 15-20 minutes. It will be entirely my personal view, and it does not necessarily represent the view of Dr. Reddy's. And secondly, all these are basically for awareness purpose only, and it does not replace any professional consultation, be it a medical consultation, or be it a lifestyle consultation, or be it a nutritional consultation. Okay. And the third disclaimer, which is a kind of on a lighter note, that my presentation may contain some of the critical medical jargon. I will try my best to explain in a simpler way for everybody's understanding. But pardon me if any of these places you are unable to follow or unable to understand. Maybe when we enter into the Q&A section, please feel free to ask me those parts. So with this, I begin. So diabetes is a multi-pronged, multifactorial disease. Now again, don't look into this slide entirely, whatever is there, because it's a heavy slide. I just want to confirm one thing to everyone, that in normal words, what we mean by diabetes is problem in the blood sugar, right? The blood glucose or blood sugar, however you call it. So and possibly many of us we know that it is a problem with insulin, right? So there is a organ in the human body, it called the pancreas, and within the pancreas there is a certain type of cell which is called the beta cell. So these beta cells, they produce insulin, which is a hormone, which is very important for the normal physiological function, especially in the blood glucose regulation of the body. Now, when due to any reason that insulin, that release of insulin is deficient, it's not adequate, okay? then we have the problem of diabetes which comes, okay, because insulin helps in reducing the blood glucose, and if there is a deficiency of insulin, the blood glucose tend to shoot up, okay, and that ultimately lead to hyperglycemia. Hyperglycemia means increase in the blood glucose level in your body from the normal level, and that hyperglycemia in turn produces diabetes. Now, with time in the 1980s, there was a concept came, it's called triumvirate, which is on the top left of the screen, you can see it. So it's just not about the deficiency of insulin secretion from the pancreatic beta cell, okay? There are two very important other aspects which also equally contribute to the development of diabetes. What are those? One is your peripheral tissue or peripheral muscle, whatever you have in your, in your body, any of the peripheral side, whenever there is a tissue or muscle, they usually what they do, they take up the blood glucose and they perform the normal physiological function. So suppose I am speaking now, right? So there are muscles around my face, around my limbs, which are working. How do they work? They need some fuel for this work, right? And this fuel comes from blood glucose. So what these muscles do, they pick up the blood glucose from the blood, and they utilize it for their own normal functioning. So when there is also a problem in all this peripheral tissue or peripheral muscle, usually we call it as a insulin resistance. There is a decrease uptake in the in all this peripheral tissue or peripheral muscle. So how does it result? It again eventually increases your blood glucose level, which contribute to the development of diabetes. And the third part, which is also very important, is hepatic glucose production increase. What is that? Usually what happens again, whenever there is a blood glucose in your body, the liver, our liver takes up that blood glucose from the blood, the excess glucose from the blood. It converts it to something called glycogen, from glucose to glycogen. And this glycogen also they store in the hepatic cell, the liver cell. Now, if there is a problem in the liver cells also, what happens that this conversion from glucose to glycogen becomes problematic. And again, so the conversion of glucose to glycogen does not happen adequately, and again your blood glucose level tend to shoot up in the body. So historically, we have only known that this is a problem of the secretion of insulin from the pancreatic beta cell. But no, there are two other equally important component which contribute to the development of diabetes. Now come to the right side of the slide. There is a term called ominous octet. So in the 1980s, a lot of research has been done, and this concept of three things, actually it became to eight things. Now I will not going to discuss, because it is very very core science, core medical science, but just for your understanding, that now this triumvirate, which is the three major pathophysiological change that happens in diabetes, has been shifted to ominous octet. Octet means there are at least 8 pathways. So it does not only involve your pancreas, your muscle, or your liver. It also involves your brain, your kidney, okay, your fat cells in the body, your gut, that is the gastrointestinal tract. Okay, all these things also get involved to be it ominous octet. And it doesn't stop there. There are many other pathways which are currently being researched to get into the overall pathophysiology of diabetes. And you can see that at the bottom of the slide, that from ominous octet, it has moved to egregious 11. That means there are 11 pathways for diabetes. From there, it is dirty dozen, 12 pathways, treacherous 13 pathways, faithless 14. So these are just fancy name which has been given in the science, but these are currently research is ongoing into all these factors. But this ominous octet, which you see on the top right hand corner of the slide, this is a very very well established fact of the pathophysiology of diabetes. So why I'm showing this to you, because when as a doctor, when we prescribe a drug to the patient of diabetes, we need to think that how this particular medicine is actually helping to address multiple pathways of diabetes. So if I give insulin, for example, insulin injection, you know about it, right? When the diabetes is really severe, it is out of control, we need to give insulin injection, regular daily or weekly insulin injection. So this is what it does. I am just giving insulin from outside. It is working on the blood glucose level and it is taking it out. Okay, that's a very simple thing. But all this lifestyle modification, the diet modification, and all the other oral medicines that we give for diabetes, they are designed to work on multiple pathways. Not only the insulin secretion in pancreas, but also your peripheral muscle, your liver, your kidney, your GI tract, even in fact your brain, everywhere. So that is the idea. Now, in general, what are the different type of diabetes? Yeah, there are two major type of diabetes. One is type 1, one is type 2. Now, type 1 diabetes is an autoimmune condition. Okay, so where there is an inherent deficiency of insulin secretion by the pancreatic beta cell. So all the other pathways that we saw in the previous slide, those usually do not contribute to the development of type 1 diabetes. But type 1 diabetes usually manifests at a very early stage, usually at your teenage, okay, in your adolescent, all those times, a very early stage, early age. But this constitute only 8 to 10% of the entire diabetes, population by large, not more than that. So maybe one in 10 patients with diabetes will have a type 1 diabetes. So though type 1 diabetes is a very dreadful condition, but it is not a problem to that extent in terms of the population, because it is only 8 to 9% or 8 to 10% of the entire diabetic patient population. Coming to the second one, the type 2 diabetes, this is the important, because this is what we usually get. Okay, there are a lot of medicines out there, a lot of research out there, a lot of complications happen for this. So this is called type 2 diabetes, which is essentially a kind of a metabolic disorder. Okay, metabolic disorder means, so whatever the previous pathways that we saw in the previous slide, they are basically for the development of type 2 diabetes mellitus. So if you are trying to prevent a diabetes, or if you are a patient of diabetes who is trying to control it, essentially you are trying to control type 2 diabetes, because type 1 diabetes you actually cannot prevent. Okay, there is no concept of prevention, because it's an autoimmune disease, it's a inherited disease, it's a genetic disease. Okay, so there is no way to prevent it. If you are diagnosed with type 1 diabetes, you are like unfortunate. That's all what I can say. But there are ways to prevent type 2 diabetes. There are ways to halt the progression of diabetes. There are ways to control type 2 diabetes. And there are a few other things like gestational diabetes, which is typically happens during pregnancy. Okay. So due to other metabolic changes that happen during pregnancy itself, the expectant mother, they can have a diabetes, but usually it remains transient, means once your pregnancy period is entirely over, your blood glucose level tend to come down. So there you don't need a very long-term medications. It can be very short-term insulin injections like that. And there are a few other rare types like MODY and all. So these are also genetic. So I'm not going to the details of this. So essentially, whatever we discuss usually is for type 2 diabetes, which is a metabolic disorder where there is an insulin deficiency, insulin secretion deficiency, there is an insulin utilization deficiency also in the peripheral muscle, liver, your gut, your kidney, everything gets involved. Now, globally, if you so this is the latest data from the IDF Diabetes Atlas. So if you see now globally across the world, nearly 590 million patients are currently living with diabetes. It's a huge number. It's a kind of an epidemic. Okay, so 1 in every 9 adult in the world, they are suffering from diabetes. Okay, and this estimated number is projected to reach more than 850 million by 2050. And on the right hand side bottom, you can see that there is an increase from 2024, that is the current data, up to 2050. So for the next 25 years, how much the population with diabetes will rise you can see globally there will be a 45% increase in the diabetes population. And if you look into the Southeast Asia, okay, here, the bottom on the left-hand side, 73% increase, you see, which is a huge number. And if you see the different region, be it Africa, maybe in the Europe and US, the rise will be a little bit less. Why? Because they are more advanced. They can target the disease at a very early stage. All those things. But if you look into Asia, if you look into Africa, if you look into Central America or South America, also there is a huge increase in the global diabetes population. And 3 in 4 adults with diabetes, they live in low and middle income countries. And of course, India also belong to a middle income country group based on the World Bank data. So majority of these diabetes patients, they are living into this low and middle income countries. Now, the fourth point is very interesting and very dreadful as well. Diabetes is responsible for over 3.4 million deaths annually. Okay, so more than 9% of global death from any reason happens due to a consequence of long-term diabetes. This is very important because the major cause is a cardiac cause. Okay, the patient may die due to a sudden cardiac arrest, a heart attack, or a stroke, all those things. Which is the maximum, or road traffic accident or other infectious diseases. Infectious disease, these are also important aspects. But diabetes and its consequence, almost 10%. So every 1 in 10 patient who are dying, forget about patient, 1 in 10 person who is dying in the world currently is due to a consequence of long-term diabetes. So this is why this is a kind of an epidemic and a very important one. And the last point, 1 in 8 adults are at a high risk of developing type 2 diabetes. So, I mean, if we have like 15, 16 people in this meeting, out of which 2 or more people have a very high risk of developing diabetes in the near future. And the one very important aspect is the diagnosis trend. So there is a lot of underdiagnosis. So if you look into the data from 4 major countries, for example, as you can see in the slide, China, Russia, Brazil, India, nearly 35 to 50% are undiagnosed. So again, like almost half of them are undiagnosed. So again, if we have like 15 people in this meeting, maybe 7 to 8 people already have some sort of diabetes started within our body if we have the risk factors. But we are not diagnosed because maybe we have not taken up the proper test, we have not done the doctor consultation, all those things. So it happens. Now you might feel that okay, this is probably an exaggeration because no, I do a regular blood checkup almost maybe in a year or once in 2 years or so. But think about the people who are living in a village or in the the rural areas. Okay, so those people do not do this kind of things. Okay, maybe we are going once in 2 years or so. So the diagnosis rate can be a bit higher in the urban population. But if you go to the rural population, there is nothing. So overall, when we pick up the countries, 35 to 50% of the patient, they are not even diagnosed to have diabetes, though they are at a stage of development of diabetes. Now, what are the risk factors? So there are 2 types of risk factors, right? One is the modifiable, one is non-modifiable. So the non-modifiable is genetics. So example like type 1 diabetes is, as I said, it's an autoimmune disease, which where there is a genetic factors. So this is something that we can't change. So these are non-modifiable risk factors. Family history. If your mother, if your parents, or if your siblings, they are having already a history of diabetes, then you have a very high risk of developing diabetes. But that is something that you can't control. Race or ethnicity, right? The Southeast Asian people have a high risk of developing diabetes than the Caucasians. Okay, so that's a kind of a race impact which is coming into us. Then increase age. The gradually when you become older, your chance of getting diabetes becomes higher. That is also something you can't do. You can't stop getting older. History of gestational diabetes. Like if you are a mother, if you had a history of developing gestational diabetes during your pregnancy, then in the future life you have a very high risk of developing type 2 diabetes in future. But that is also something that you can't really control, right? Then again, certain medications, like for example, steroids. Okay, so if you are taking steroids for some other reason, steroids like glucocorticoid, they itself increase the risk of diabetes. Also, that is something that you can't control if you really need steroids for some other disease. But the good part is, this is only a smaller part of the picture. The larger part of the picture is on your left hand side, which is the modifiable risk factor, right? Like if you are overweight, obese, you can cut down your weight. If you are inactive physically, you can do a lot of exercise. Poor dietary habits, cut the junk food. Then if you have hypertension, control hypertension. That means high blood pressure. If you have dyslipidemia, like the blood cholesterol problem, control that blood cholesterol problem. If you are a smoker, if you are an alcoholic, cut down all those things. So these are the things that you can actually modify on your own and reduce the risk of developing diabetes. So there are a couple of risk assessment tool. I think you can take a note of this two website which I have mentioned. One is diabetes.org/diabetes-risk-test, and one is the riskscore.diabetes.org.uk/start. So these are very simple, medically authenticated tool, and very simple. You just go to the website, it will hardly take 5 minutes. It might ask you for some data, so just be prepared to that you have those data with you, like your body weight, your height, maybe what are the medications that you were taking. It can ask, and also some of these things may ask if you have blood pressure, lipid problem, all those things. So just be ready with those data and just fill it in. It will show you that what is your chance of getting a type 2 diabetes in the next 5 to 10 years of time. Okay. So usually if you are below 5, it will show. When you click on the result, it will show you that if you are below 5, then you have a low risk. Something like between 5 to 8, it will be a moderate risk, and beyond 8, it will be high risk. So it's a very quick thing to do, like 7 to 10 questions max to max. And it can be done within 5 minutes if you have the data ready. And you can get a medically, scientifically validated tool and the result that can tell you that what is your risk for developing diabetes in next 5 to 10 years of time. So do that for today, and please, you can share this link with your family members and your friends also, and they can do it. Now, what are the signs and symptoms? Usually diabetes, why there is a problem with diabetes so much in the world? Because it's a kind of a silent killer, okay? In many patients, you will have a heightened blood sugar level, but you won't be able to understand it. It will not give you any signs and symptoms like any other disease, okay? So that is why the diagnosis is also very low, and that actually adds to the problem. But still, there are some type of warning or signal that you can feel. Like for example, you may have a blurred vision, peeing more than usual, feeling thirsty all the time, feeling very tired usually, okay, tired and exhausted. You don't get into work all the time, losing weight without even trying to. So you see that your body is losing weight and you are getting lean and thin, but you are not actively trying for any weight loss. That is a sign of diabetes. Then there is a cut or wound which is taking a long time to heal than usual, and consistent itching around your penis or vagina, or you are repeatedly getting a genital thrush kind of a thing. Okay, so these are some of the key symptoms and warning signs that you may look for, but eventually this is not true for most of the patients. Now, coming to the complication of diabetes, this is very important because, see, the complications are two types. One is acute, one is chronic complication. Now, the acute complications are very, 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 very rare. Okay. If you are taking the first one is important, which is mentioned here, hypoglycemia, as you can see on the left-hand side. Let me just open the pointer. Sorry. Hypoglycemia. This is basically due to some medicine. So if you are taking insulin, for example, sometimes your blood sugar level may fall way below normal, and you can have a hypoglycemia. Or this diabetic ketoacidosis. That means your body, gets a lot of ketone bodies, which is not good for your body due to diabetes, and you go into a coma-like stage, and you need to get admitted in the hospital. But these are extremely rare. What problem is the chronic complications on your right hand side. Now there are within the chronic also, there are two type of complications. One is macrovascular, one is microvascular. Macrovascular is more important, more dreadful because they can cause death, okay, in the long run. What are those? Like diabetes increases risk of stroke. We call it as a cerebrovascular disease. Diabetes increases risk of heart attack or any other cardiovascular disease. And also it causes poor circulation to the limb, leading to something called PAD, peripheral arterial disease or peripheral vascular disease. So these are chronic complications which is very, very dreaded, because if you don't control your diabetes properly, it can lead to a stroke or a heart attack in future. Okay, which is of course like something which you all understand is not a good thing to happen. There are some microvascular complications also which are equally important, but they might not lead to a certain sort of death or something, but they can lead to retinopathy, which is the eye damage. Okay, so in the long run you can have blindness, kind of a thing, due to we call it as a diabetic retinopathy. Then nephropathy is a kidney damage. Okay, so eventually more than 2/3 of the patient with diabetes, they have some sort of kidney problem. Okay, so more than 2/3. So it's a so diabetes is a kind of a disease which affect the kidney very, very frequently. As I say, 2 out of 3 patients in diabetes will have some kidney problem. Okay, so the nephropathy, and finally neuropathy. So many of the patients of diabetes, they feel some sort of tingling or numbness in the peripheral limbs. So this is due to something called peripheral neuropathy, because a long-standing diabetes also causes nerve damage, and that leads to neuropathy. So these are the overall picture of what are the diabetes complications. Now, don't have to go into the slide. I just wanted to highlight one point. We doctors, we very frequently say something called CRM, which is a acronym for cardio-renal metabolic complications of diabetes. Cardio, you of course understand. It can have a heart attack, it can have a heart failure, it can have a stroke. All these things comes under the cardiovascular complication. Renal is kidney. So any problem with the kidney that happens due to diabetes are the renal problems. And metabolic is what? The normal diabetes itself, and also it can lead to obesity. So diabetes and obesity is also very, very, very closely linked nowadays. Okay. So like again, more than half of the patient with diabetes will become obese. And the vice versa also, like more than half of the patients who are obese will have diabetes. So these are interlinked. So this is a CRM kind of a complication triad that we say in our medical term, cardiovascular, renal, and metabolic. Now again, there is also one very nice scoring calculator. Okay, you can go to this website also and check by yourself. You can just type www.mdcalc.com/ and you can just go to this one and type score to diabetes. Okay, so this gives you, so this is important for a patient who is already having diabetes. Okay, not for someone who is not diagnosed with diabetes. So a patient who is already having diabetes, if they look into this score to diabetes score, he or she will can actually predict their cardiovascular risk in the next 10 years. Okay, so again, there are a few parameters which you need to fill up, and if you fill them up, it will give you a score. If it is more than 20%, it's a very high risk, as you can see. If it is between 10 to 20, it's high risk. If it is 5 to 10, moderate risk, and it is less than 5%, then you are a low risk of developing a cardiovascular complication in a patient with diabetes. So again, a very useful, freely available and scientifically validated tool to predict the cardiovascular risk in patient with diabetes. Now, I will not go into the slide, but just one key highlight out of this slide is early and intensive glucose management, blood sugar management is very important to prevent. So there are n number of studies which has shown that if you control diabetes very early from the beginning, in the long run, in the next 10 to 20 years of time, it will cut down your cardiovascular or kidney complication. Okay, your cardiac or kidney complication. So just for example, if I am a patient with diabetes, okay, I am diagnosed like now at a very early stage, and I am doing extensive, I'm taking all the diet, lifestyle, and medication, everything. It will help me to prevent the the cardiac and the kidney complications in future. But suppose one of my friend is having also diabetes, but he is thinking, okay, let me check, let me try. If it goes, even worse, then only I will start all those things. No, that patient, that person will have a very high risk of developing a cardiac or renal complication, kidney complication in next 10 to 20 years. So what are the unmet need currently that as a doctor we face? Poor glycemic control is very important, because in spite of so many drugs, so many medications now available, still there will be a lot of patients who will not have the optimal or adequate blood sugar control. Then many patients will need insulin also in type 2 diabetes, right? Because insulin is an injectable. So of course we don't like to take an injection on a regular basis, like every day or every week or something like that. So that is a problem. Obesity in diabetes patient, as I was saying, that it is right now, it has become a twin epidemic. We call it as a twin epidemic. We call it as a diabetes and obesity. So they go hand in hand. Like half of the patient with diabetes will have obesity, half of the patient of obesity will have diabetes. Then, as we discussed about the cardiac and kidney risk in diabetes. And finally, medication adherence. It's very important that you stick to your diet plan, your exercise plan, and your medication plan very effectively, the way it has been advised to you by the professionals, be it a doctor or your nutritionist or your lifestyle coach, everyone. So there is a very, very beautiful thing called half of rule of half. Okay, it's called the total patients who are currently diagnosed with diabetes. Sorry, they have diabetes in the world. Only half of them are diagnosed. So what we see currently as doctor is only half of the entire problem. Within those half who are diagnosed, only half of them may receive proper care. Again, don't look into only the metro cities or the urban areas. Think of the rural areas. Even if they are diagnosed, they do not have an access to proper care, proper medical care for the diabetes. Those who are receiving the care, only half of them they achieve their target. That means they still have uncontrolled diabetes. And who are achieving their target, half of them actually have the desired outcome in terms of their lifestyle and disease control. So that means if you come to this half, all the half, it will be like only 5% of the entire diabetes population in the world who is actually having a very good control and they can achieve the desired outcome. Now, how we diagnose thing. Now, this is important. While because you can be diagnosed based on two major things, I would say, which are on your left hand side. One is something in your blood, which what we measure is the called HbA1c. Okay, that is the most important thing that we measure in the blood. Second thing is your fasting blood glucose. So if you are doing a test for diabetes diagnosis, you have to give your blood in empty stomach. Of course, like after at least 10 hours of fasting, better 12 hours. So means you have your dinner, say at 8 p.m. the previous night, and next day morning at 8 a.m. you are giving the blood. So both this HbA1c and the fasting glucose can be tested with a single draw of blood. Okay, the same blood sample can have both. Now there is something on the right hand side also, like 3 and 4, which are the 2-hour postprandial blood glucose that we call it. So here means you have your breakfast, and after having after 2 hours having breakfast, then again you give another blood test to check the postprandial blood sugar. But right now, all the major guidelines say that this is not important. If your diagnosis of HbA1c and fasting blood glucose, these two are sufficient to call you whether you have diabetes or not. So usually for HbA1c, if it is less than 5.7%, you are a normal person. Between 5.7 to 6.4, you have something called pre-diabetes. That means you are not having a frank diagnosis of diabetes, but you are entering into it. And if your HbA1c is 6.5% or more, then it is a frank diabetes you are diagnosed with. Fasting plasma glucose, if it is less than 100, it is normal. If it is between 100 to 125 mg per dl, again, you are into the pre-diabetes range. And if you are having 126 or more, you are frank diabetes. So for the pre-diabetes, usually medications are not required. You can control them usually with just your lifestyle modification, like some diet changes and some exercise. So there are various continuous glucose monitoring devices also which are currently available. Like you can have it on your smartphone or handheld device with the help of a smartwatch and the sensor. But again, I will suggest these are only for patients who are having a long-term diabetes and they need intensive, monitoring of their diabetes. Otherwise, for a normal people who have, who are just doing the test to detect diabetes or have been detected with diabetes, but it is well within the control. You don't need all these fancy devices at all. No matter how much you see on Instagram Reels or marketing gimmicks that you see, no need to believe in that. You do your test, just a simple blood test on HbA1c and fasting blood sugar, maybe every 3 to 6 months. Once, once in every 3 to 6 months, based on your doctor's advice, of course, that is sufficient. Now, so I am not a nutritionist, okay? So I will refrain myself from giving you the diet advices. But there are few, normal things I would say that how much sugar you should take. You should not take more than 36 grams of sugar in a day. And for women, it should be limited to 25 grams in a day. Trans fat should be eliminated as much as possible, and the overall fat content also has to be limited, not more than 6% of your total calorie intake. And you need to have a very high fiber diet, which is helpful for diabetes patient. For exercise, at least 150 minutes, that means 2.5 hours of moderate intensity aerobic activity per week, or 75 minutes vigorous aerobic activity per week. So I would suggest to go with the first one. So if you give 5 days a week, if you count, so 150 minutes means you need to just give half an hour every day for 5 days a week for a moderate intensity aerobic activity. So that can be a treadmill, that can be a basic weightlifting, that can be even a brisk walking also for half an hour, maybe for 2 to 2.5 kilometers. That is also fine to do to begin with, and then you test your possibility, and then you go to you can increase them as well. And some of the muscle strengthening activities also important. So we usually think that only walking will be everything for you exercise. No, that's not true. You need to do some muscle strengthening activity also, and for that you don't need high end gym subscription or something. Just buy 2 dumbbells or barbells at your home. Just do that at your home in the morning. Okay, so that is sufficient. You go on a morning walk for 30 minutes or maybe 20 minutes, come back, do a 10 minutes of muscle strengthening exercise on your own at home, and you are done. That's it. So this is the problem that we usually face. We think that if I have to do lifestyle modification, I need to get a subscription of a gym. I need to, buy this, buy that. People start buying things, but eventually they do not do those things, right? So the idea is that you do in the morning, you go for a walk for 20 minutes, brisk walking, not just a kind of a fancy walk. You go for a brisk walking in the morning for 20 minutes, come back, do a 10 minutes of dumbbell or barbell, whatever you can get at your home, just a muscle strengthening exercise for 10 minutes. You are done of the day. You do it for 5 days a week. That will be sufficient for you to begin with. Sleep is very important, at least 7 hours. I know 9 hours of undisturbed sleep is possibly not possible for professionals like that. Maybe in the weekend it is possible, but not on the weekdays. But at least 6.5 to 7 hours of undisturbed proper sleep is important. And of course, you need to cut down your smoking or alcohol habit. So there are multiple drugs. So now, of course, I will not go into the medicines per se, but we now as a doctor, we have enough medicines to treat diabetes, to control diabetes now. The only problem that we see is that which medicine is suitable for which patient. So that is something. And the patients usually they do not adhere to the medications properly. Okay. So that is important. So nowadays we have the new drugs also, like the drugs which we call it as a glyphosine, the SGLT inhibitor or gliptin, or the GLP-1 analogs, okay, who also does a lot of weight loss as well, along with diabetes control. So these are the new drugs which are available in the market, and these are extremely good drug. Now, each medicine has some side effect. Okay, there is no medicine on earth which do not have any side effect. It has. That's the bottom line. But the thing is the risk benefit ratio. Okay, that is important. Whether it is giving you the benefit and the benefit is outweighing the risk or not, that is the important thing. So don't, start reading things on Google and think, okay, the doctor has given me this medicine, it can cause this, so should I take it? You stop that. No, don't do that. Okay. Maybe, okay, I'm not saying that you should not read, you should not question anyone. You have every right to question your physician. But read about it. If you have any concern, ask your doctor. Ask your doctor properly. Ki, doctor, I have read somewhere about this side effect. What is your take on that? How can I avoid that side effect? The doctor will give you the advice, follow that advice. But do not stop your medicines just by looking into some Instagram reels. You will see, I also see a lot of Instagram reels nowadays saying, don't take this medicine, it's bad for your health, blah, blah, blah. All these things. No, those are not true. Those are not scientifically bad. As I'm saying, each and every, if you take a single paracetamol for a fever, that can also cause your problem in your liver. So each and every medicine come with some sort of side effect. The only thing that your doctor knows very well is whether it is good for you or not. So discuss. If you have any concern, feel free to discuss with your doctor. Don't look into all those Facebook or Instagram things or Google things and just do on your own. That's my humble submission to all of you. So diabetes complications, we have already talked about it. So if you look into all the current guidelines, which are they are globally across the globe, along with glycemic management, that means blood sugar management, you need to manage your blood pressure. So if you have a high blood pressure, make sure that you are taking medicines for your high blood pressure and you are controlling it. If you have a lipid problem, that means blood cholesterol problem, manage it with proper medications. Don't shy away from medicine. Medicines are there. So each and every medicine which come into the market, they go through a rigorous scientific development. Okay, they just don't. I won't name anyone, but there are people, right, who suddenly come into the social media and tell, okay, I have this, I have that. This will, cure your diabetes. No, it doesn't happen. It doesn't happen that way. There are science behind it, which we need to follow. And finally, the last pillar that you can see is the cardiac and kidney benefits. So that is also you need to check very well while having diabetes. So these are the various, guidelines. So I just have 2 or 3 more slides and I'll be done. There are multiple global associations are there in diabetes, like American Diabetic Association, European Association, and we have our own Indian association as well. So they always come up with the guidelines. I just want to focus on 4 things here. Just look into the wheel. Okay. So initially, diabetes management was all about your blood sugar control. But as I said in the previous slide, it's nowadays it is not just blood sugar control. Blood sugar control is important, but at the same point of time, you have to give protection to your heart and kidney. Very important. Number 3, you have to do the risk management, like your blood pressure and your blood cholesterol. These have to be managed properly. And finally, weight management is very, very important in diabetes. If you can't manage your body weight, if you are a patient with diabetes, medicines will not, you can't control your blood sugar. That's for sure. You have to manage your body weight accordingly. So there are 2 terms which goes very frequently, as I see in the internet nowadays: diabetes reversal and diabetes remission. So let me tell you very upfront: diabetes reversal is a wrong term. It's a wrong thing. I have put some words on it that usually diabetes reversal refers to a process of reducing blood glucose level below the diagnostic threshold by lifestyle changes and weight loss and sometimes drugs also. But this is not a medically recognized term. Okay. Diabetes. So please be informed that there is no cure for diabetes. If you are diagnosed with diabetes, you have to deal with it for the entire life. Now, how you deal with that, that is different. You may require just one simple oral medicine throughout your life. You may require 3 or 4 medicines throughout your life. You may require insulin throughout your life. You may require nothing. You may require You may, require just your diet and body weight management, and you are good to go. But you cannot cure diabetes. It's not that you had a fever, you took and you got cured. Cancer can be cured. There are multiple cancers which can be cured now. Tuberculosis can be cured. Diabetes cannot be cured. It can be only controlled. And nowadays, a lot of research is happening of diabetes remission. Now, if you go into the bottom part, it's called diabetes remission, which is a medically recognized term. That means that you are there at least for 3 months without any diabetes medicine, but your blood glucose is controlled at the normal level just with your diet and lifestyle modifications. Okay. Now I have put some website address, like Fitterfly is a good one. Fitterfly.com, then there is a ind.twinhealth.com and app.sugarfit.com. They have some programs. Now, again, I am not supporting all this kind of a programs, but you can just go to their all these websites and have a look. They have these programs, but those are expensive. All you can do on your own itself at your home. You don't need to do any sort of managed program by paying a subscription fees. That's for sure. But yes, you can have a look into the websites and read about this. So this is how we call it as a diabetes prevention and diabetes remission. So there is no cure, there is no reversal. These things do not happen. Either you prevent diabetes from happening, that is a type 2 one, or if you are already there, you control the diabetes, that is the most important part that you do, or there can be a potential remission as well. So these are some of the WHO criteria. Practical tips that you can say: eat a healthy diet, remain active, avoid tobacco, control your blood glucose, control your blood pressure, and also control your blood cholesterol. Get a regular checkup at every 3 to 6 months at least. Adhere to the medication. The last point is very, very important, because that is one thing that you can easily do without going, without compromising your health. So this is also the same, just an additional part, how to prevent the complication of diabetes. So essentially these are same. So controlling diabetes is not a very difficult one. Okay, you just need to do 4 things. One, you do your lifestyle measure properly. That means you cut down your junk food, you do an exercise, as I said. Second, you control your associated factors, like you control your body weight, you control your blood pressure, you control your blood sugar. Number 3, do not forget your medicines. Okay, that is very, very important. And number 4, consult your doctor or your healthcare professional at a regular basis. That's it. You can control your diabetes with that. So thank you very much. I will stop sharing. I hope I have not exceeded the time by multiple factors. I'm not sure, but yeah, thank you for your patient listening.
Thank you, sir. It was very informative. You have touched upon all aspects of diabetes. Thank you so much. I'll now open the stage for 5 minutes for any question and answer for Dr. Biswas. If anyone has any pressing issues that they want to ask,
Yeah.
the stage is, you can raise your hand and we can take any question. And if there are no questions, we'll move on to the next segment.
Thanks, Saurabh.
Okay, we have TM Tuku. You can unmute
Yeah.
and ask your question.
Hello, doctor. I have a
Hi.
question.
Yes.
Sir, sometimes India is referred as diabetic capital because we have large number of diabetic patients in our country. So I want to know, what are the problems with our diets? For example, most of the people, around 60% of Indian, they eat rice. It is our staple food. And if you look below the state, Madhya Pradesh, below Madhya Pradesh, there are many states, including southern India. So most of the state, they cannot grow wheat because of their climatic condition. So they are prone to eat rice as their staple food. So I want to know if rice become a problematic for diabetes in the future, and if what other alternatives that we can think of. For example, like parboiled rice. Parboiled rice can be a solution to diabetic patient. Is rice a problem to diabetic patient? I want to know.
Yeah, understood your question. So I would put it in like this: rice is not the problem, but quantity of rice is the problem. Okay. So usually what I see, as you mentioned, below Madhya Pradesh also, we eat a lot of rice. So that is something which we need to cut. I know that so I'm a Bengali, okay. So even for Bengalis also, rice is the more preferred kind of a thing. But what we see usually that we eat a lot of rice. So that is something we need to cut down. And also we need to stop the eating any carb say after 9 p.m. or so. Ideally it's after 8 p.m., but that is not practically possible in our household. So maybe after 9 you should not eat any carbohydrate. So what can you have in your dinner is, I'm not saying to remove rice completely, because that is not possible, as you rightly mentioned, but limit the quantity. Okay, maybe just I mean, little bit of like 100 grams or 150 grams of rice, and you substitute the rest of the rice with sabjis. Okay, you can have a lot of boiled vegetables, you can have fish, you can have chicken, or you can have paneer or whatever it is, if you're a vegetarian. But have a lot of those things, have a lot of dal, pulses, have a lot of sabji. Limit the quantity of rice that you are having. So that is a good way to do it. Now, the other type of rice, like even the black rice, usually it is said that these are good, but honestly, I have not come across any like kind of a substantial scientific backing which can say that those alternatives are better than the normal rice. Okay, so there is a long way to go. Currently, with our economic status and our population status, it is impossible to replace rice with something else. That is not going to happen. What you can do is, the only thing: limit the quantity of rice, take a small portion of rice, and replace the other portion of rice with the uh, sabjis or the other part of the thing. So that is the way I also do, because I am also a person who loves rice. Okay, but I tend to replace the rice a little bit with other things, the side dishes, preferably sabjis or chicken or some fish, something like that, and plan not to have any carbohydrate type of food after 9 p.m. So make sure that you have at least 1.5 to 2 hours of time after dinner before you go to bed. Yeah.
Thank you so much, Dr. Biswas, for your answer. It's a very common question for us.
Yeah. I know.
Anyone else want to ask? I'll just take one last question. And if you have more questions, then you can always forward it in the guest group or to me, and I'll forward it to Dr. Biswas. So please don't worry that your question was not answered. Just one last question we'll take.
Sure.
Yeah,
Please raise your
I have
hand.
one question. Sorry.
Yeah.
So my name is Vikram, and I'm curious to know about this pre-diabetes, because sometime back I've been told that I'm pre-diabetic. So I was then expecting that I doctor will tell me something, but then he said nothing to worry. But now
Yeah.
I came to know that even you said that it can be changed over diet and exercise and stuff like that. But is it possible that it becomes diabetes over time, or is it but only a temporary thing, which will get reversed after we follow the diet, the
Yes,
proper
so
diet?
it is not a temporary thing. Once you have entered into the zone, you can control it there for sure. Okay, so if you can control it there with simple change in your lifestyle, as I said. Now, usually what happens, Vikram, that even I have also seen it, that we tend to plan a lot of things. If I am diagnosed with pre-diabetes or diabetes, or with any other disease, and because we try to implement so many changes at one point of time into our life, and then we can't do that. So that is the way where we are actually faltering. So if you are in a pre-diabetes range, my father is also in a pre-diabetes range for last 30 years. He was diagnosed like almost 25 years back in a pre-diabetes range. He is not on any medications. I do his test every 6 months. Okay.
Mhm.
He doesn't eat sugar at all. Like, I mean, once in a while, maybe if there is a ceremony going on, he might take a small bite of a sweet or something. Nothing else. He does not take sugar. He doesn't eat rice in the evening. Only maybe one chapati with lot of dal and sabji and all those things. He does a morning walk of like 15 minutes, not more than that, because he has other problems for which he cannot do a vigorous exercise. But he makes sure that he does a 15 minutes of walking, brisk walking in the morning, or sometimes in the evening also. He doesn't eat, even sugar in his chai, in his tea, or anything. He has cut down his smoking like drastically. Right? Like he was a chain smoker of like 20 cigarettes per day. Now it has, over the years, it has come down to maybe 1 or 2 cigarettes in a day, not more than that. So he has done all these changes in his life, and I do a close monitoring on every 6 months. I make sure that I get his HbA1c and other tests done, and he's just in that range of between 5.7 to 6.2, that range for the last 30 years without any medicine. So Vikram, there is nothing to worry. You just need to follow the simple things in your life. 15 to 20 minutes of brisk walking, maybe 10 minutes of an exercise in a day. Just avoid the added sugar in your life. Added sugar. See, in our normal cooked food, we need to add a little bit of sugar, which is also fine, but avoid that added sugar. Make sure that your blood cholesterol and your blood pressure is under control if you have them. If you don't have them, then it is fine. I think, and maybe we all can try to reduce stress from our life a bit. That is also very important, because stress-induced diabetes is also something which I forgot to mention in the slide, but because you brought it up, kind of a thing. But stress-induced diabetes or stress-induced hyperglycemia, okay, which is actually then can transform into a frank diabetes. This is very important. I know it is not easy to do than it is said. Stress management is very difficult thing in our life, especially if we are in a corporate job or something. It's very difficult. I completely know that, but I mean we have to try. We have to try to manage our stress at all. So if you do all these simple things in your life, you will not turn into a frank diabetes for sure. I can tell you that.
Thank you so much,
Thank
Dr.
you.
Biswas. Yes, I'm really sorry we can't take any more questions. We have to move on. So with now, Dr. Biswas, we would like to present you with the certificate. I request our Zoom master, he is spotlighting a certificate. And now we'll take a picture with you. Thank you so much for coming and presenting this wonderful session.
Thank you very much.
Yeah.
Thank you very much. It's a pleasure. It's a pleasure. And if anyone has any further questions, please feel free to forward those to me. I would try to answer them. No worries. Yes, I won't be, as I said, I won't be replacing it with a pure medical advice, but some kind of a guidance how we will manage this. That is something I can always tell. Thank you very much.
Thank you, sir. And now we'll take a group picture as well, where with you, so that we can remove the spotlight. Yeah. I request everyone to please come on camera and take a group picture with Dr. Biswas. You can put a heart emoji as well. So our Zoom master, please tell us when we should be ready and smile.
Sure. Yeah, get ready. 1, 2, 3.
Yeah.
Thank you all.
Thank you, our Zoom master. Thank you, Dr. Biswas. You can
Thank
stay
you.
back and enjoy our regular Toastmaster
Sure,
meeting
sure.
if you have time. Thank you so
Sure,
much.
sure. Thank you very much. Thank you very much.
Yes. So we'll now proceed with our Toastmaster meeting. We are running a little behind, so we'll just do a very shortcut version of our Toastmaster meeting. We have our prepared speech that's coming up next. We have one speaker, that is Toastmaster Rehan Ansari, and I'd like to call Toastmaster JK Aurora to give a brief introduction of his project and the details of the evaluation. Over to you, Toastmaster JK Aurora.
Thank you, Toastmaster Ishita, and good afternoon, fellow Toastmaster and guest. It is my absolute pleasure to introduce today's dynamic speaker, Toastmaster Rehan Ansari from Navi Mumbai. Rehan holds an MBA in marketing and has a true passion for connecting ideas with people. Rehan invigorates every conversation he becomes a part of. whether he's sharing insight, presenting ideas, or simply engaging with audience. So today topic of Rehan is Project Mastery L2P Project 1, and speech title is Speaking Me. So please join me in welcoming Toastmaster Rehan Ansari.
So, Toastmaster Rehan, speaking me. Speaking me, Toastmaster Rehan.
Good afternoon, fellow Toastmasters and guests. Have you ever wondered what your unique communication style says about you? How do you express your thoughts, emotions, and ideas? Today, I want to share with you a little about speaking me. When my personal communication style, how I discovered it, and what is it mean for me? Communication is more about listening. Okay, so I will focus. When I started paying attention to how I communicate, I realized three things about myself. Very first, I'm a listener. Naturally, uh, I listen more when I speak. I find that my truly hearing what others say, I can respond more thoughtfully. Listening helps me understand not just words, but feeling and intentions behind them. Second thing, I communicate calmly and clearly. When I speak, I tend to keep my tone calm and measured. I believe this helps create a comfortable space for dialogue, even when discussing difficult topics. Third one, I value empathy. I try to put myself in others' shoes before responding. This empathy shapes how I phrase my words and examples I use. It helps me connect on a deeper level, and I build trust. Let me tell you a personal story with your permission. Can I? At work, we once faced a challenging project deadline. The team was stressed and tension were high. During a meeting, I noticed some frustration bubbling up. Instead of jumping in with the solution right away, I listened carefully to everyone's concern. Then I calmly summarized what I heard and acknowledged the pressure we were all feeling. The simple act of listening and reflecting helped me. The team feel heard and valued. It shifted the mood from frustration to collaboration, and we found a way forward together. This experience showed me the power of my communication style, how listening, calmness, and empathy can transform a difficult situation. Of course, no style is perfect because I listen so much. Sometimes I hesitate to speak up quickly, which can make me seem reserved. My calm tone might be mistaken for a lack of enthusiasm or urgency. Recognizing these challenges helps me work on a balancing my style, being more assertive when needed and adding energy to inspire action. In closing, speaking me is about embracing my natural strength, listening, calmness, and empathy, and using them to connect meaningfully with others. So, with this, I would like to say one more thing. My grandmother always used to say that हमें 2 कान क्यों दिए गए हैं पता है? एंड हमें एक ही मुंह दिया गया है बोलने के लिए. So always remember, beta, whenever you speak with someone, try to listen more. That's the reason we are given 2 ears. And when we listen, just listen to understand. Don't listen to react. Instead of reacting, respond. So I learned from my grandmother in my childhood, like the best use of 2 ears. Always try to listen, try to understand, listen to understand, and never react. Always respond and be empathetic. Thank you so much for listening to me. Over to you, Toastmaster of the Day. Thank you.
Thank you, Toastmaster Rihan. That was a brilliant speech with emphasis on listening that we all need to learn. And now I'd like to call upon Toastmaster GK Aurora, who has been listening very keenly to evaluate your speech and give you your evaluation. We at Sattvic do it in a little different format so that we call the evaluation right after the speaker. That way, the impact is fresh, both on the speaker as well as the audience. I would like to now call upon Toastmaster J.K. Aurora. Over to you.
So let me begin with the privilege of listening is a truly refreshing speech. The voice modulation is excellent, and both story, good connection of your grandmother, and title Speaking Up. So just like the old saying goes, an apple a day keeps the doctor away. So Rehani's speech was a daily dose of inspiration and certainly self-doubt, and there's no hesitation at bay. And you have captured the attention with pauses, with words, and very voice modulation is very good. Especially I appreciate the topic. You are very that everyone in the room relate to with it, and your ideas are connecting with it. Now the points which you should have to be improved. Now call to action. Now call to action, I think you should have more the content on that on the last. Maybe you can add the idiom or some other thing, so that we should more relatable to the fact that speaking me the topic is like challenging and other things. You have to, like, closing line should be more better. Means like if an apple a day keeps the doctor away, then a strong message, a speech can keep mediocrity away. So overall, it is a fantastic job, and just keep speaking you, because the world need more of it. Thank you. Reha. Over to Toastmaster of the Day.
Thank you, Toastmaster J.K. Aurora. You have been listening very intently, and you have also used the word and the idiom of the day. So kudos to you for paying so much attention. After this invigorating speech and evaluation, we'll now move on to our table topics. Since we are running a little late, we'll only have 4 table topics. And I'd like to now invite our table topic master, Toastmaster Vikram. Now, those who really want to participate, please raise your hand, because only 4 slots will be given the opportunity. So fastest finger first. Over to you, Toastmaster Vikram.
Thank you, Toastmaster of the Day. And it was a brilliant meeting. I had so much of learnings since the beginning. And now, just to give you an introduction about the table topic section. The table topic section enables a member to develop the skills of impromptu speaking. And table topics help train the members to quickly organize your thoughts and express it freely. You can think of the table topic speech as a mini speech with an opening, body, and a conclusion. This section also provides a speaking opportunity for members who are not playing any roles or who are the guests right now. So the rules are like the speaker is required to speak for at least 1.5 minutes. So the maximum time given is 2 minutes.
And beyond that, there will be a card shown, like the green card will be shown at the end of first minute, an yellow card at the end of 1 minute 30 seconds, and the red card at the 2 minutes. So the speaker has to conclude the speech when he sees the red card. Okay. So, and we are also encouraged to use the word of the day and the idiom of the day. So after this invigorative session, let's begin with this refreshing table topic section. So the first speaker for today is Elios.
Hello.
Hello, Elios. So Toastmaster Elios, is it better to eat 3 big meals or several small ones throughout the day? Is it better to eat 3 big meals or several small ones throughout the day? Toastmaster Elios.
Hi, I would like to invigorate you with my information about healthy diet. And for this time, I would like to persuade you that if you should eat little but several times, you need to have a pause or a break for it. Or at least you can just make it every 2 hours you eat something. Just a snack, and then it can help you to be full, not to eat 3 whole meals every, like what you have done. 6 a.m. and then 12 p.m. and then the other one is 6 p.m. Because our body has been treated that time from the child when we were child that we need to eat 3 times a day. But don't forget, we need to fulfill the nutrition, and you need to give extra nutrition by drinking milk. In Indonesia, we call it for healthy, fifth perfection. So we need to eat the carbohydrate, the protein, the fat, and the mineral. Then don't forget, an apple a day keeps the doctor away. So that's how I balance my diet and to keep on myself being invigorated. And yes, just take it little by little because that's make your stomach better to digest it all. Thank you.
Thank you, Toastmaster Elios. I think you have disclosed that Japanese secret as well. They usually eat in bits, right? And rather than having a big meal, I think you're also suggesting the same thing. Thank you for that, taking the topic so wonderfully. So the next speaker is, let's take, I don't see anyone raising hands. Is anyone raising the hands? Okay, I see Rehan Ansari raising his hands. I see Toastmaster Tukur also raising and Mohini. So we'll go with 3 of you. So let me give the chance to Toastmaster Tuku now. Oh, Toastmaster Rehan who's been spotlighted, sorry. So Toastmaster Rehan. How do you stay motivated to work out when you don't feel like it? How do you stay motivated to work out when you don't feel like it? Toastmaster Rehan.
Okay. How I feel motivated when I like to walk out, right? This is the topic, if I am not wrong.
When you don't feel motivated, how do you motivate yourself when you don't want to do workout? That is the topic.
Okay.
I'll put it on the chat as well.
Yeah, please. Oh, timer is not kept on. Have you put on in the chat box the title?
Yeah. Just a minute. Okay, how do you stay motivated to when you don't feel like it? That is the topic. I'm putting it on the chat.
Okay. Whenever I hear the word motivation, it reminds me of the time when I was very young. My mom used to tell me whenever I deny to complete my homework, she used to tell me, Beta, whenever you feel like I don't want to do this, always remember why you have started doing this. Okay? Now you are in third standard. You already passed first, second, and you are in now third standard, and you are denying to complete your homework. So why you went to school? This is your third year. So whenever you feel demotivated, always think why you have started. And second thing, always remember what is the outcome of whatever I am doing. That will put you into motivation. And you will start continuing what is right for you. No external force is required at all. The best motivation is within. Okay? So, self motivation is the best therapy, I can say. Thank you so much.
Thank you, Toastmaster Rehan. So I love that, understand the outcome of whatever you do in the beginning so that keeps you motivated. So that's really great. And next, let's go with TM Tuku. So the topic
Yes.
for you, how do you unplug and recharge after a long day? How do you unplug and recharge after a long day, Toastmaster Tuku?
All right. Hello, everybody. So the question is, how do I unplug and recharge myself again? Well, nowadays everybody wants to become something, to be rich, to earn a lot of resources in our life. We need to recharge we need to invigorate ourselves to so that we can come to the mainstream again and work for our aims and goals. So generally I follow one method that really keep me away from the doctors. And this method is, I believe that there are 4 sources of energy for a human being. But most often we do not recognize that these are the sources of energy for a human being. And these are very simple. And these sources of energy are our physical energy, mental energy, emotional energy, and spiritual energy. These are the sources of energy for a human being. If anybody is working on this area continuously, that person will be invigorated and empowered to confront any challenges of life, any challenges, right? So these are the, first of all, we have to recognize these are the energy for a human being. Second, you have to walk upon this area so that you can make yourself powerful. Remember the Darwinism law, the survival of the fittest, still working in our society, right? It is the best, the people who are powerful, it is the people who are mentally fit, they ultimately survive, right? So that's why if somebody is working upon this area, you will become mentally, how can you work upon this area? If you want to be physically fit, go and run, you can hit gym. And second, how can you make yourself mentally fit? Just give some good information, read books, read novels, read newspaper, give information to your brain. Spiritually and emotional, most of all we mistaken with emotional. We have to be emotionally autonomous. So these are the area, if you work, you can become powerful and you can invigorate yourself. Back to you, topic master.
Thank you so much, TM Tuku. What a wonderful take on this topic. I think you've spoken about the 4 main areas of our health: physical, mental, spiritual and emotional. I really echo with whatever you said. And thank you for putting that points forward. And next, let's go with Toastmaster Saurav Tiwari. I saw you raising the hands, then I saw you put down your hands. Are you interested to take a topic now, Saurav?
Yeah. Somehow
Okay.
I got disconnected. That's why.
Okay. Sure. So, Toastmaster Saurav Tiwari, how do you manage stress in your daily life? How do you manage stress in your daily life, Toastmaster Saurav Tiwari?
Vikram, how do you manage what?
Stress
Stress.
in your daily life.
Thank you so much, Table Topics Master, for this lovely question. Before I share my secrets of managing stress, I would like to give a reference of a famous, a bit old Bollywood movie. If I'm not wrong, the name of the movie was Munna Bhai MBBS. But I'm not talking about the hero of the movie, which was Sanjay Dutt. I am referring to another character in the movie. It was Boman Irani, who was probably playing the role of the principal of a medical college. He played the role of a person who used to trouble others, and as a consequence, he used to receive also a lot of stress in his life. Throughout the movie, it was shown that he is very happy and he used to laugh like ha 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 ha. But somewhere towards the end of the movie, someone asked him, "Hey, we have seen you always laughing, but we really don't understand where are the jokes? Why are you so happy?" And he said, "You don't know. I laugh because I don't know any other way to handle stress in my life." I really loved his thought. I don't know whether that thought got injected somewhere in my mind or life taught me to live in the same style. But when I grew up and I noticed no matter what and no matter how you do, things usually go out of your control. And being stressed, feeling worried, feeling annoyed is definitely not a solution. We need to fight with the adverse situations in life. And the best way to face challenging situation is to maintain your peace, to stay happy, to stay calm, and to face every situation with a smile on your face and an energy in your heart. And to do that, even if you are not happy, but you smile, you can handle all the stress in your life. That's my way. Thank you so much, Table Topics Master.
Thank you so much, Saurabh, for that invigorative speech. I echo with you, and I also have the same style. So whenever I feel down, I have the big smile on my face, and I enjoy every moment that way. So I truly love the topic that you took and the way you spoke about it. I think, given the time, would you like me to conclude, or shall we take one more speaker? What do you think, Ishita?
No, Vikram, we won't have time. We have the evaluation section.
Fine. Then let's conclude this section, and thank you so much for all the speakers. Over to you, table topic. Sorry, team one.
Thank you, Toastmaster Vikram, for this invigorating table topics section where you covered almost every aspect of health in your topics. Very well done. And for all the speakers who came up and spoke, it takes courage to raise your hand and come up on stage. For those who wanted to but could not, there's always next time. We always have opportunity of table topics. Please come again and participate. It's really very rewarding to speak in a table topic section. With that, we'll now start the evaluation section. I'll now call upon our general evaluator, Toastmaster Amarnath, to please come up on stage and start the evaluation. Over to you, Amarnath. You're on mute, Amarnath. Have you stepped away? I think we have lost Amarnath for some reason. I'll go ahead and get started with the section of evaluation. Oh, you're there,
Hey,
Amarnath. Okay.
Sorry, I got an important call. I couldn't able to avoid that.
Okay, no
Sorry.
worries, no worries. Yeah,
I'm
go ahead.
really
Yeah,
sorry. Yeah.
go ahead.
All right.
Please start.
Sure, Ishita. So let me go ahead with my tag team. Timer, may I request Timer to give his report? And also, meantime, Timer, can you confirm all the table topic speakers are eligible for the voting so that we
Yes,
can launch
everyone
the poll?
qualified.
Okay. Meanwhile, I'll launch the poll. You can start with your timer report.
Yeah, thank you, General Evaluator. I am back with my report. Before I announce it, kudos to all the speakers today. Mostly everyone did a fantastic job to stay within the time limits. Here is my report. For keynote speech, Dr. Mansi Biswas delivered the speech for 45 minutes. And for prepared speeches, Toastmaster Rehan Ansari delivered the speech for 5 minutes 24 seconds, qualified. For evaluation session, evaluator 1 Toastmaster JK Arora spoke for 1 minute 41 seconds, disqualified. For table topic session, table topic speaker 1 Toastmaster Relios spoke for 2 minutes 10 seconds, qualified. Table topic speaker 2 Toastmaster Rehan Ansari 1 minute 40 seconds, qualified. Table topic speaker 3 Toastmaster Tuku spoke for 2 minutes 19 seconds, qualified. Table topic speaker 4 Toastmaster Saurabh Tiwari spoke for 2 minutes 9 seconds, qualified. Here is my thank you, General Evaluator. Over to you.
Thank you very much for the crisp report, Sharon. So may I request our grammarian of the day today, Toastmaster Aniket. Yeah, Aniket.
Yeah,
Aniket, I request you maybe to turn off your video because sometimes your network connection is not
okay.
working.
Okay.
Yeah.
Yeah,
So that we can hear your report. Thank you.
yeah. Yeah, so the word of the day were used by several speakers. Toastmaster Ishita used the word of the day, Toastmaster Vikram, Toastmaster Elios, and Toastmaster Tuku also used the word of the day. The idiom of the day was also used by Toastmaster Jekara, Toastmaster Elios, and there were some good usages of the grammar like what is it for me by uh, Toastmaster Rehan and uh, never react respond and also like some of the improvements that could be done like tension were high that could be pressure or stress was high so yeah so this is it from my report and
Thank you very much, Aniket. Going back to our counter, Ishita, can you present your counter report?
Thank you, Toastmaster Amarnath. I'll now start with our report. Toastmaster Amarnath used "a" 3 times and "so" 1 time. Toastmaster Rihan used "a" 4 times, "okay" 3 times, and "so" 1 time. Toastmaster JK Aurora used "means" as a filler word 2 times and "like" as a filler word 1 time. Toastmaster Bikram used "so" 1 time, "right" 1 time, and "ah" 1 time. Sometimes we use the word "okay" and "right" to ask the audience for confirmation. It may be applicable in a conversation setup, but when you are a speaker, then that will distract the audience. So that is not to be used as a filler word. Then Toastmaster Ilios used "ah" 1 time. Toastmaster Tuku used "okay" 2 times and "ah" 1 time. Toastmaster Aniket used "ah" several times, including in between words. I would recommend any person who uses "ahs" frequently to record using Udly in our toastmasters.org website, and that would make you aware of the number of usages of filler words and help you correct it. That way, that can be done. And Toastmaster Saurav and Charan did not use any filler word. that I could catch. That's all for my report. Over to you, Toastmaster Amarnath.
Thank you very much for that detailed report, Ishita. So let me proceed with my general evaluation overall the meeting. So we have started with a little late, 5 minutes late. Most of the role players are ready by the time, but we are waiting for the guests, so we don't have any control on that. But we can get start with the meeting on time when all the role players are ready and the keynote speaker is also available today. So that is the one takeaway from this meeting. We can get start on time. And coming to the our Toastmaster of the day, Ishita has took up 3 roles today, and she really done in all the roles commendable. Kudos to you, Ishita. Keep it up, and it is very helpful for the overall club to grow. And coming to the timer, timer can be prepared well before the meeting. How virtual Zoom meeting is organized, and it is responsibility for the club also to get them trained who are the new role players are coming into the meetings, so it can be taken care of front. But later he picked up the role seamlessly, and he performed his role commendable for today. And coming to the grammarian, so he is prepared with the word of the day and idiom of the day, and he has posted his take track of whoever is using the word of the day and idiom of the day. And maybe I would recommend a grammarian to check the network and good condition so that it will not cause any interruption in the meeting. So our evaluator of this speech today, for J.K. Arora sir, he give the feedback to the speaker. So it can be little more elaborate on the what are the recommendations we can give it to the speaker. So you have enough time, maybe you can use a little more on the feedback front on that. And table topic, Vikram took, the topics are really echo with our theme of the day and absolutely sync with the keynote speech. And I really surprised, like when I think of the theme of the day and what could be the apt table topics, but he really come up with good table topics, and it is really nice. And all our table topics today are really awesome. It's really invigorate to the topic, the theme of the day today. So that is my overall feedback. Thank you. It's back to you, our presiding officer, Ishita. Thank you.
Thank you, Toastmaster Amarnath, for your detailed general evaluation report. It was definitely a very invigorating session with learnings, feedbacks, enjoyment, fun topics, whatnot. And we would like to encourage all of you to keep coming. Now I'll end the session and move on to our presiding officer role, where I would like to, where we have 2 polls to be conducted. Please don't leave the session yet. We have the auxiliary role poll that will happen for the, please vote for the best auxiliary role. And that is on your screen right now. And as we do that, we will try to ask our guests on what is their feedback. All our guests have dropped. Okay, we have to Anjali, who's still here. Anjali, would you like to unmute and say a few words on when you joined the session and what it was, your experience?
Yes, hi Ishita. Thank you for this opportunity. It was a really nice session. I explored a lot how Toastmaster Club is functioning and how it helps in enhancing the public speaking and articulating our thoughts on the spot. And so yeah, looking forward to joining as a member soon. Thank you.
Thank you so much, Anjali. It was lovely. I think we spoke on the phone, right? Earlier.
Yes.
Yes, it was wonderful that you could come and attend a keynote session where we are presenting both the healthify side of Sattvic as well as the public speaking side of Sattvic. So that's great. I'd like to call upon our keynote speaker, Dr. Mansij Biswas, who was gracefully stayed till the end. What is your feedback for the session, Dr. Biswas? It is very kind of you to stay all the way till the end.
Yeah, thanks, Ishita. No worries. I was looking forward to how because this is my first session of Toastmasters, so I thought of staying till the end. Yeah, I think the table topics were very much pertinent to the present context and the present society that we are living in, and this is extremely important. And the way the presenters or the speakers expressed their own thoughts on it as an impromptu basis is really something which is commendable. And the overall management of the program and the way you guys are giving the feedback for self improvement, this is extremely important. And honestly, I would also like to have some feedback from all of you.
It was a wonderful session, sir. And when you speak for a very long time, there are definitely some things that we can improve upon. And that is what we would recommend, that if you give keynote speaker speeches, then Toastmasters is the great platform for you to come and practice speaking if you're
Right.
interested. Yeah.
Right.
And
Yeah.
all right, so we will now announce the results. Any guesses for best table topic speaker? Okay, those. Rihan is raising his hand. You get the best speaker anyways.
Thank you.
All right. Come on, guesses. Best table topic speaker. Okay, I'll reveal the secret. It is Toastmaster Tuku. Toastmaster Tuku, are you present in our guest group?
No, I'm not in the guest group.
Okay, I'll now ask our Zoom master to please share the link of our guest group on the chat so that Toastmaster Tuku can join. And we would love to have you in our guest groups. And there we'll share the certificate with you in that group. Thank you so much for coming and presenting your speech today. Our next category was Best Auxiliary Role. Any guesses on who was the best auxiliary role?
Master Ishita.
Well, your guess is correct, Toastmaster Rehan. It is Toastmaster Ishita. Thank you so much for voting for me. I'm glad that I could be of service and help you in your path for improvement. Next is our best lead role player. Any guesses? Any guesses for our best lead role player? Going once, going twice. It is Toastmaster Vikram. Congratulations, Toastmaster Vikram. Your topics were very interesting and you were able to captivate the audience with your interesting topics. Thank you so much for bringing us this Toastmasters table topic session. Usually our table topic session are longer, but because we have keynote session today, we cut it short. Please join again for more interesting topics. With that, I think, okay, one important announcement is next week we are having our club elections. So all the members will be encouraged to join and vote for the next leaders that are coming up. And that's why the regular Toastmasters session will be cut short again, depending on how long the elections go. And those who want to nominate themselves, the nomination officer has already sent their contact details. Please send your nominations by today. Today is the last day for sending your nominations. So those were the announcements for today. We'll now officially end the meeting. I'd like to ask our Sergeant at Arms to please close the meeting and end the recording.
All right. Thank you very much for all who have joined and make this meeting so successful. With this, officially, I adjourn the meeting. So we'll stop the recording and continue with the further discussion.